When should I start cleaning my baby's mouth? Maintaining infant oral hygiene is very important because it maintains oral health, clears milk and food residues, and avoids buildup of bacteria. It helps the baby have healthy gums and teeth. Baby teeth, also called milk teeth, hold the spaces open for permanent teeth to come in. Although most babies do not start developing teeth until they are 6 months old, it is recommended to begin cleaning the baby's mouth as a newborn, even before the teeth appear. Teeth brushing may begin after the teeth start appearing. It is also recommended to take the baby to the dentist before the first birthday to ensure appropriate dental health. How do I clean my baby's mouth? The baby's mouth may be cleaned twice a day. The following steps can be followed while cleaning the baby's mouth. You should make the baby lie down in your or a caregiver's lap, and you should hold the baby's head close to your chest so that you can clearly visualize their mouth. You may use a damp washcloth, soft towel to gently rub the baby's upper and lower gums. Teeth brushing may begin after the teeth start appearing, which is usually after 6 months of age. You may use a soft bristle, infant-sized toothbrush that has been approved by a dentist to gently brush the baby's teeth with a very small amount of toothpaste. Cleaning the baby's tongue can be a challenge because they seldom cooperate. You may try distracting the baby with interesting activities and toys to be able to clean their tongue. You may gently rub a soft cloth dipped in lukewarm water over the baby's tongue to clean it.